Reflecting as a third-year medical student by Hameeda Y M Akoojee, Obstetrics and Neonatology Part 1. This video will focus on my role and responsibilities as a doctor in training, my expectations of this clinical rotation, and the leadership qualities I possess that will support my professional growth in the medical field. My role and responsibilities as a doctor in training. I need to acquire knowledge and learn to practically apply this knowledge in real-world situations so as to become proficient enough to perform it confidently. I have to observe those around me, whether it be my superiors or colleagues. I should assist where possible and offer guidance when necessary. I must be able to, through meticulous history taking and examination, identify problem areas and intervene to the best of my ability. If unsure or unable to provide adequate assistance, I should notify someone, my senior. Learning to work in a multidisciplinary team involving my classmates, other doctors, nurses, physios, and dietitians, etc., is of paramount importance. I should better my communication skills so that I may converse with patients and colleagues alike to ensure that everything is clearly understood so that we can make decisions in the best interest of the individual being cared for. Tying in with the previous point, I need to work toward fostering mutual understanding between myself and any person I may provide care to. Mutual understanding between my peers should also be established so that we are all, with regard to content and context, on the same page. These can only be achieved through effective communication. It is also my role to defend and protect those who are in my care as they are vulnerable. My expectations of this obstetrics and neonatology clinical rotation. Seeing as this is my first rotation as a medical student, I am unsure of what to expect from my clinical rotations. There are, however, some basic skills that I would like to develop. I want to learn how to adequately apply my theoretical knowledge to real-life scenarios. This rotation should teach me many skills through observation of my colleagues and superiors and adequate practice under the watchful eye of those more experienced. Skills that I would like to become adept at include history taking, acquisition of accurate vitals, examination of a pregnant woman, and also of a neonate, as well as drawing blood, gaining IV access, and administration of the intramuscular injection. I also want to enhance my communication skills and learn to collaborate with others effectively. Lastly, I would like to mention a few leadership qualities I possess that I believe will support my professional growth in the medical field. Respect, an essential, often overlooked. I wholeheartedly believe that if one gives respect, they will receive it. As a hands-on profession, being a medical doctor requires that I be courteous with those I treat. This will build rapport, allow a patient to divulge information essential in their management, and enable them to adhere to said management. Being respectful toward my co-workers will foster a positive environment that is highly productive. Empathy. Viewing life through a more gruesome lens causes medical professionals to become unsensitized, almost as a means of protecting themselves mentally. This often causes them to become unfeeling toward their patients and creates a wall between patient and practitioner, causing a dissatisfied patient to withhold key details pertaining to their well-being, which could result in catastrophic outcomes. I intend to retain my ability to empathize with those I encounter so that I may create an environment in which they feel free to express themselves. Attentiveness. Attention to details both observed in the mannerisms and spoken words of an individual are important clues as to their health and well-being. This quality will enable me the capacity to take action early and possibly save people in need of immediate assistance. Level-headedness. When under pressure, I am able to retain my composure and think and act in a logical manner. This quality is essential in life-threatening situations requiring prompt action, especially as a leader of a team. The individual responsible in making decisions and then executing them through the skills of themselves and those assisting them. Decision making. The ability to make quick, informed decisions appropriate to circumstance is a rarity. Though I require a lot of experience before I can use this quality of mine to its ultimate capacity, this will prove to be a most valuable tool in the immediate management of my patients. Initiative. Not many have the courage to step forward and take a lead. They are unable to do so because they doubt their capabilities and are afraid to make a mistake. Most times, I experience this as well. However, I muster up my courage and usually take the initiative in these situations, not because I am completely confident in myself, but because I see these moments as a learning opportunity and a method of motivation to others. I am, however, worried that this habit of mine may just be instinctive and one day land me in trouble. Determination and focus, a quality that is very useful as a medical student. There is almost always something that I need to revise. Hundreds of hours need to be put into my studies so that I can absorb the mountains of fundamental knowledge that needs to be ingrained within me. Therefore, determination and focus are marvelous attributes to possess so that one does not cave under the workload and become overly burdened. Innovation and creativity. In South Africa, where resources are scarce, even in the health system, being able to persevere through non ideal circumstances requires some creative and unconventional alternatives, provided that they are safe practices. My innovative mind, I believe, will aid in my growth as an adaptable medical professional. This reflection helps to organize my thoughts before beginning my first clinical rotation. Part 2, that I will release in approximately 2 weeks, will delve deeper into my experiences during that time. That's all for today, folks. Thank you.